In this section, we will talk about the central venous line. A central venous line, as you know, is a catheter that is inserted going into the patient's heart, and the tip of which rests in the superior vena cava. This catheter is meant to either measure the central venous pressure, also known as the right atrial pressure. You can also give medications with this catheter, and you can withdraw bloods for blood sampling. So this is a very helpful catheter for a patient who is critically ill. The catheter can have a different number of lumens. A central venous catheter can have just one lumen for measuring the central venous pressure or medication administration, or it can have 2 lumens or 3 lumens. For example, the catheter here has 3 different lumens. What you will notice is that if you take a closer look at the catheter, it has little holes in the middle, here, and at the tip of the catheter. These are actually where the lumens end. So each lumen has its separate tube, and if you were to cut this catheter like that, you would see that it consists of 3 different tubes inside, each of which ends in a different place. So this is very useful because we can do a few things at the same time with this catheter. For example, we could be measuring the central venous pressure, or as I said, the right atrial pressure. We could be giving medication, and we could use another lumen to withdraw a blood sample. The lumens are named and color-coded. There is a proximal, distal, and a medial lumen. In general, your distal lumen is the largest and will be used to measure the central venous pressure. The distal lumen, since it's the largest, is also a good choice to give blood products. The medial lumen can be used for blood sampling or for medication administration, and the proximal lumen can be used for the same purpose. In general, the proximal lumen is preferred for blood sampling because if the patient is getting a medication, this is the lumen most removed from the heart and most removed from any medication that is being given to the patient, so that your blood sample will not be mixed with it. To demonstrate that the lumens actually end in different places, I have a syringe currently attached to the distal lumen, and if I push down on the syringe, you will see that that is where it ends. And compare that to the medial lumen. If I push down on a syringe attached to the medial lumen, you will see that the fluid comes out in a different place.